It's amazing to me that 11% of the population of Australia live with asthma. That's 2.8 million people. And that it's the leading cause of illness for children. It's what's making our children sick. It's what's putting them in hospital. It's what's making them miss out on sport, on outdoor activities, on socialising with their friends. And we all know what happens when you can't do those things. We all know about the health and the mental health implications of that. It's a really big issue, is it not?
Yeah, it is, Nicky, and that's why we're working with Breathe Better Illawarra here at Healthy Cities Australia to try and do something about it.
So I'm Nicky Sloan. I'm the CEO of Community Industry Group, and I'm coming to you today from the beautiful lands of the Dharawal people to bring you Community Matters, the podcast that explores issues that are important in our community with people who are making a difference. And today I'm joined by Alexander Brown, and Alexander is the Asthma Program Coordinator at Healthy Cities Australia. Welcome, Alexander.
Thanks very much for having me, Nicky.
So I can see with statistics like that why we would need to have an asthma program. Could you tell us a little bit about the Breathe Better Illawarra project?
Yeah, sure. So Breathe Better Illawarra is our Healthy Cities Australia's program looking at raising awareness around asthma and addressing some of the causes of asthma and some of the causes of poor treatment of asthma in the Illawarra area. We started the program, it was really Asthma Australia who started the program. That's the national peak body for people living with asthma, so the consumers. And they came down to Wollongong a couple of years ago and started piloting, trying to figure out what they could do here in the community to improve things for kids with asthma. They realised that a local partner organisation would actually be probably a good way to do that, and then they connected with us and we started our program. So we've been going now since July last year. And we aim to raise awareness about asthma, to try and improve the way families manage their children's asthma, with the ultimate goal of reducing the number of kids who end up in hospital because of their asthma.
And does it just focus on children and families? Because there are a lot of adults on there living
Yes,
with asthma.
absolutely. The issue of asthma is much broader, and we do try and take a broad approach. We are primarily looking at children. Children obviously are vulnerable. I guess it's also just around our funding parameters and the sort of issues that Asthma Australia wanted us to focus on. But I guess one of the things that is unique about our approach and that came into the thinking from the beginning is the idea of an Asthma Smart Community. And that includes people with asthma and people who don't have asthma. It includes people of all ages, especially schools and community organisations, people who have responsibility for children, to have more awareness and understanding about things like asthma first aid and knowing what to do if a child has what people often call an asthma attack, but which we prefer to call an asthma flare-up. We use the term asthma flare-up because it emphasises that asthma is a chronic disease. People with asthma tend to treat it as an acute illness. They've got an asthma attack and then it's over. But we know underlying that in their lungs, there's an inflammatory process that's there. So they need ongoing treatment and management to look after that. And that's kind of key to improving management.
Is there a reason that Asthma Australia chose to focus on the Illawarra? Do we have higher rates?
No, we don't have higher rates of asthma, but this is actually a continuation of early work. It sort of gets a bit complicated, but Asthma Australia came out of Local Asthma Foundation. So this is a continuation of some of the work that the Local Asthma Foundation here and the Pearl Shepherd Trust were doing back in the day. And so that's why it's here in the Illawarra.
And an Asthma Smart Community, that seems like a very clever way to look at this, because as someone who's not suffered with asthma, it is really hard when you see somebody struggling and you don't know what to do to help them.
Yeah, so we really want people who work in sort of child environments where they're looking after children to understand asthma first aid. It is part of your ordinary first aid, but they also can do a free training on Asthma Australia's website, which can give us some specialist advice around asthma first aid. But one of the big issues, one of the big program areas we work on is our self-management workshops. So we find that a lot of the time when children are diagnosed with asthma, it's showing the sort of problems that are developing in our primary care system. They're being kind of rushed through the GP's office, or they might be seeing a range of different doctors at different clinics. They might end up in hospital with an acute episode, so a flare-up, And then when they're referred to the GP, they get different information about how to look after it. So we find kids can end up on a bit of a merry-go-round trying to find the right way to look after the condition. But without understanding a bit more about asthma, just having a script doesn't really help the family to look after it. So we've been working with the Illawarra Shoalhaven Local Health District's Community Asthma Education Service. It's an amazing service we have here in the Illawarra, which is based on nurse specialists who work in an asthma-specific role. And their role is both clinical, so they actually do take referrals, and anyone in the community is welcome to reach out to them and make an appointment for themselves. But they also have a role in education and raising community awareness around asthma and its management. And we get those nurses to come in to community centres and schools, and we held workshops where they get to spend a few hours with the families and really get into the detail. What is asthma? What are some of the triggers? And understanding your triggers is a really good way to help prevent having, flare-ups, because if you know certain things are going to trigger you, you can stay away from it. Mm-hmm. But importantly, it's about understanding the medication. So a lot of people are using over-the-counter reliever medications, sort of blue-grey puffers, when they have some issues. And that's great, but a lot of people will benefit from having other ongoing preventative medication. So in those workshops, the nurses can really get in some detailed conversations, answer questions. And we also provide a bit of a unique space because we get some of the wonderful circus community here in Wollongong to come and do workshops with the kids, and as well as enjoying some physical activity, which is a great way to improve overall health for children and keep them out of hospital as well. It gives the parents that undistracted time to really focus on understanding what can be a complex, medical condition, and improve their skills and knowledge about how to help their kid to manage that asthma.
You spoke about an asthma first aid course that's available free on the Asthma Australia website.
Yeah.
Would you encourage everybody to do that course?
So everybody who works with children, definitely, yeah. So that they can go onto the Asthma Australia website and find that information. Asthma Australia website is a wealth of information for schools and for families, including their 1-800 number, which is 1-800-ASTHMA, where they can book a call with an asthma educator during business hours and get all kinds of information and advice about how to best look after their asthma.
Fantastic, and we'll make sure we put the link to that course in the show notes, so if anybody's interested in that. So, how could anybody who's tuning in today, how could they get involved in the work that you're doing and support your work?
Yeah, well, this program is part of Healthy Cities Australia's broader work in community health and preventative health. So we'd love people to jump onto the Healthy Cities website, healthycities.org.au, and become a member of Healthy Cities. We're really trying to expand our membership at the moment. That's a great way to support us. For people who would like to come along to one of the workshops, we'll be organising one in April next year. We organise them in the school holidays. So they're welcome to get in touch with me through the Healthy Cities website. You can find our number or email address and book in. But I guess the other broader issue we're looking at in terms of an Asthma Smart Community is our built environment. So we know, for example, that indoor gas appliances are associated with potentially up to 12.3% of childhood asthma burden in Australia. That was based on research done, published in the Medical Journal of Australia. So we've been working hard this year with Wollongong Council to see if we can get some revisions in planning regulations to start to phase out those gas appliances and replace them with safe, healthier electric alternatives. And we're really happy to see that the new chapter of the Development Control Plan that will be going on exhibition shortly does include those controls to start to accelerate the transition to healthy electric buildings. So we're also looking at those broader community areas where, air pollution is an issue that's perhaps not well understood, but increasingly research shows that it affects not just asthma, but a whole range of conditions. People with asthma are particularly vulnerable to getting colds and flus, or rather, when I say they're particularly vulnerable, if they get a respiratory infection, it can trigger their asthma.
Right.
And we know that with better indoor air quality standards, we could actually reduce the amount of transmission of those respiratory or those bugs that are going around schools and public buildings, just like we started to learn about in COVID. But unfortunately, a lot of that knowledge and awareness seems to be slipping away. And some of the standards that perhaps should have become ongoing have disappeared. So at the moment, one of the things I'm working on is the New South Wales Parliamentary Inquiry into indoor air quality. We think that improving indoor air quality will benefit people with asthma, but it'll actually benefit all of us because the range of conditions that are affected by polluted indoor air is quite extraordinary. I've been learning myself a lot about it in this role. So that's another area we're always looking to build community coalitions and advocacy around improving indoor air quality.
Do people grow out of asthma?
Yeah, that's a funny one. They don't really grow out of asthma. Asthma is a chronic illness, and if you have asthma, you have that tendency. And, you know, I mean, I'm not here to give, obviously, clinical advice, but we always recommend to people, if they've had a diagnosis of asthma, to have an ongoing conversation with their doctor or healthcare practitioners around that. Because sometimes, for example, people might not have a lot of trouble later in life with flare-ups, but they are still more vulnerable. There's a phenomenon known as thunderstorm asthma, which can occur. We're actually lucky in Wollongong because of our climate and the mountains. We don't really have it here. But in Melbourne about 10 years ago, there was a thunderstorm asthma epidemic where 10 people died. And what happens is a thunderstorm picks up pollen, carries it some distance, and it shatters the pollen into tiny, tiny pieces, which can become lodged in the lungs. So people who thought they grew out of asthma as a child, or people who didn't even know they had asthma, people who just had things like hay fever, were actually susceptible to that and started having asthma flare-up symptoms. And it happened at the same time all over the city of Melbourne. Now, even with the best ambulance service in the world, you can't reach everyone, and that's why so many people died in that event. So it's a dangerous idea to think people grow out of asthma. People who've had a diagnosis of asthma need to take care of their asthma and always consult their doctor.
12.3% of asthma flare-ups are associated with gas appliances. Is that?
Yeah, it's one of those complicated, medical mathematical modelling. So it's 12.3% of the childhood asthma burden. And what that really means is just basically about 12% of the amount of sickness that asthma creates could be attributed to exposure to indoor gas appliances. Now, there's a couple of aspects to that. One is that we know that some of the pollutants that are released, so the nitrogen oxides that are released when gas is burnt inside the home. So that's a fossil fuel. It's methane burning inside a closed indoor environment. And we've all grown up with it as very normal, but we're increasingly understanding that actually that's actually quite polluting. That actually sensitizes, so it makes the lungs more sensitive. And so there is some evidence that could be making people more likely to develop asthma down the track. But for people who've already had asthma, it can be a trigger. That doesn't mean it's a trigger for everyone with asthma. And I guess there's different things people can do. So obviously, if you've got a range hood, just switch that on. And because there's not only asthma, but there are other risks associated with those pollutants, including just the particles that come from your cooking. So making sure we use range hoods. A lot of the time people have them, they don't switch them on. Open the window. And I guess as Healthy Cities Australia, stepping back a little bit from that, we're looking at equity. So we've got a fantastic electrification movement here in Wollongong that's pushing to get all electric homes. We know that's the healthiest, most economical and climate safe way to energize our homes in a range of different functions. However, the rollout of that is not necessarily reaching the people who need it most. It's difficult for renters to access a lot of these electrification technologies or subsidies. So really, at that policy and advocacy level, we're really interested in trying to broaden that conversation. We need to get electrification into things like renting standards in New South Wales. It's already starting to happen in Victoria and the ACT. For example, Victoria recently introduced legislation that will mean that landlords need to start upgrading those gas appliances at the end of life, not straight away, but to start to make the rental stock safer for everybody.
Mm-hmm.
So improving housing quality, especially rental standards, is something that we're going to be focusing on, especially next year, doing our advocacy work, because another issue that really affects people with asthma to do with climate change is extreme temperatures, so extreme heat and cold. So one of the other areas Healthy Cities works in is our Healthy Urban Environments community of practice. We work with built environment and public health experts to build up their knowledge. They're all working in councils, they're working across different industries, and it's a bit of an information sharing place. We also do a little bit of advocacy there as well. But we recently were looking at the relationship between housing quality, climate change, and the mental health impacts. But we know that, thermal performance, so whether buildings can be kept cool in the summer and warm in the winter, is really important for people with asthma as well. So those are some of the issues where we want to work more with partners in the community to raise awareness, but also push our policymakers to enforce stricter standards in building.
I guess one of the areas, one of the groups that would be really impacted by the inability to upgrade their appliances, and certainly by the thermal impacts, would be people in social housing.
Yeah, that's right. Yeah, it's really important that we start to transition our social housing stock. And one, we need a lot more of it because housing equity is a factor for all people with all kinds of conditions, including asthma. But particularly, we know the thermal performance of a lot of social housing properties is not adequate. There are some programs to upgrade some of those properties. For example, community housing providers are accessing some subsidies from the government to upgrade their properties, but they're having to put in a co-contribution. So community housing providers don't have the spare capital lying around to pay for, potentially expensive thermal upgrades. We really need a fully funded government scheme for community housing providers to be able to finish that, to meet the growing challenge of climate change for people in social housing.
So my final question, it's the question I ask everybody. The podcast is called Community Matters. Could you tell us about somebody in the community that matters to you?
Sure. I'm going to shout out my mum. We actually came to live in the Illawarra for her to work in community health here as the Director of Sexual Health, which she finished in that role after about 30 years recently. And I think now that I'm myself working in community health, I really understand how important that work is. In her time, she worked a lot on AIDS, which was a major epidemic when she started, and now is well managed with medication. But it really took bravery to take on, a lot of conservative attitudes that people, gay and lesbian people, deserve to have AIDS, or all these kind of ideas. And just to go, no, this is a public health issue. It doesn't matter what people do in their personal lives. They all have a right to that, and go out there and advocate, provide incredibly effective measures through often quite simple things, like condoms and safe sex practices, or in the area of hepatitis C and injecting drug use, to see all those decades of work that have really made Australia's population a lot healthier. So I think it shows with community health and public health approaches, we are in a serious crisis in our health system at the moment, and we need to maybe return to the roots of public health and community health and look at those simple community-based, equity-based approaches to really start to turn the ship around. And I think, looking at my mum's career, that's really been central to that. So,
what an inspiring woman, what inspiring work. Yeah, what an inspiring body of work. Well, thank you so much, Alexander, for coming in today and for talking through something that is really going to have an impact on a large number of children and families and people living with asthma. Thank you for the work you're doing at Healthy Cities Australia. And thank you for tuning in today to Community Matters. The podcast that explores the issues that are important in our community with the people who are making a difference. Please like this episode, leave us a review, share with your friends, and tune in next time for more Community Matters.